Good afternoon, everyone. Welcome to my page, Dr. Rekha Segal, Homoeopathy for Mankind. Today, I'll be discussing a very important topic, that is menopause. So, let's start with the topic. Now, what is menopause? Menopause is a natural biological process which occurs in the female's life where there is a stoppage of menses permanently, and it is labeled as menopause when the female doesn't have menses for at least 12 months consecutively. Usually, the age which is assigned for menopause biologically is between 40s to 50s. The period when the female is approaching towards the menopause is called as the perimenopausal period. Now, what could be the signs and symptoms with which the patient could present to you with this? The first and foremost is the irregular periods. As you all know, because of the natural declining of the hormones in the female could present to you with an irregular cycles. It could be heavy, it could be in less quantity, or there could be a skipping of the cycles, that she's not having the cycles regularly, she's having for 2 months and then again it is getting stopped. So the irregularity of the cycles, or there could be a heavy bleeding also, or there could be a scanty flow. So this kind of menstruation problems are called as transitional menstruation cycles. The next is the female could present to you with lot of at the level of mind, the lot of irritability or low mood, or there could be a lot of anxiety feature, you can see. There could be a hot flushes, chilliness, sweating, palpitations with which the female can come to your clinic. There could be a loss of hair, the massive loss of hair, or thinning of hair. There is dryness of the scalp is there. The weight gain issues, the female is suddenly putting a lot of weight and she's approaching towards you. So this could be the multiple signs and symptoms with which the patient can present to you in your clinic with this problem. So being a homeopath, it's a duty to take in-depth the detailed case taking, that what is causing these all problems. Now, what are the causes of menopause? As I have discussed, the first and foremost is a natural process where, as it there is a natural gradually declining of the hormones progesterone and estrogen in the body, because of which the ovaries stop ovulating and there are no cycles. Or the patient could give you the history of surgeries, that could be the surgical removal of ovaries, or because of some uterine ailments, removal of uterus. So this could lead to menopause early. The third is there is a history of medications, especially the steroidal ones, because of which the female could have this menopause. And in cases of rheumatoid arthritis or psoriasis, where there is a long use of steroids, or the females could have the history of chemotherapies or radiotherapies. Now, what could be the complications for having a early menopause? The first is that because of the low levels of estrogen in the body, the bones getting weak, there is a disturbance in the calcium metabolism, they are getting weak, their density is getting reduced, the bones are getting brittle, and they are prone to fractures. The female could have certain urinary ailments, that could be the frequency of the urine is increased, there could be involuntary urination, or there is a involuntary urination during coughing, laughing, talking, or walking. There could be a dryness of the internal sexual parts, because of which the female could have a loss of sexual interest, or there could be an itching or itching issues out there. The female could have, because of low estrogen, the female could have the heart problems. They're more prone to heart problems like palpitations or anxieties, So these are certain complications which are to be considered when the female are approaching menopause or when they are having a early menopause. Now, what is our being an homeopath? It's our duty, or it's to take the detailed case taking in depth, that what could be the reason for this menopause. If it is natural, it should be handled very gracefully, and if it is because of certain problems, so you have to take out the symptoms, how the individual is experiencing this problem, and you have to make the totality at the level of mind, at the level of body, to prescribe the similar. Now, what is the homeopathic approach of dealing the cases of menopause? As I know, as I have discussed also, a lot of signs and symptoms with which the patient could present. So it's your duty to take the totality at the level of mind, at the level of the body, to confirm the symptom. Now, first remedy which I want to discuss is Ectia racemosa or Simsifuga racemosa. It is a very important female friendly remedy in which you will find a lot of muscular soreness of of all over the body. There could be a low mood, and the female is dull and depressed because of this problem, and there could be headache issues is there. The second remedy is lachesis. It is, as you all know, this remedy is useful in cases where there is an ailment, as the causative factor is suppression of discharges. The female could have a lot of irritability, melancholia. There is lot of loquacity, and it she could have a lot of sleep. All the complaints are getting aggravated after sleep. There could be flushes of heat, palpitations. The third remedy is sepia, where the female could have a lot of unusual, or you can say, bleeding from the uterus, and there is a lot of bearing down pains, irritability at the level of mind. The prolapse of the uterus is there, and the fainting attacks and the hysterical responses to the problem. The next remedy is Helonius. It is also a very good remedy where there's a debility, there is a lot of weakness because of unusual bleeding from the uterus. The next remedy is Glonine. Glonine is recommended in the cases where the female is having a lot of flushes of heat, or there is a palpitations or headache is there, and the headache is creating a lot of problem in her lifestyle. Now, there are certain biochemics which you can prescribe in your practice, which are very important. The first is a Kali Phos. As you know, it is a very good remedy where the female is having a lot of anxiety, sleeplessness, nervousness, or insomnia is there, and the next remedy is natrum phos. Along with this problems, the lot of digestive troubles, especially the erectations or belching or indigestion, eructations. So these are complaints could accompany. The third is a calcarea phos. As you all know, that because of low levels of estrogen, the calcium metabolism is also disturbed, and because of which the female's bones are getting weak. So you can have to provide additional calcium supplement. So calcarea phos is very important. Hecla lava can be used. So these are some of the medicines which you can use in your clinical practice, but with a caution, you have to in depth take the detailed case taking, that what is, if it is naturally, then how she's having, how she is taking this problem, and you have to individual make a similar minimum for curing this ailment. So now, what are the lifestyle modifications which can be used? First and foremost is that practice relaxation techniques, as it is a natural process which is going in the body, and it is affecting the hormones at the level of the mind, at the level of the body. That's why it is having a lot of varied presentation. almost in every sphere. So you can have yoga, meditation, deep breathing exercises. The dietary part is very important because in these cases you have to take a diet which is rich in the fruits, or which is providing all the nutrition supplements like proteins, carbohydrates, vegetables, and soya bean is very beneficial. Plus there are certain herbal combinations which are now introduced, that is flax seeds, lettuce seeds, black cohosh, which can sometimes taking or introducing in their diet could reduce this hot flushes or palpitations in the female's body, and limit the sugar intake, avoid smoking, caffeine, and uh, take a diet which is rich in calcium because bones are getting weaker. And you have to avoid the stress, or if you are having a very sedentary lifestyle, try to do some exercises, or make a routine to help your body in becoming active. So these are, I think I have tried my level best to describe this problem in detail, and hope this video could be beneficial to you. If you have any queries regarding this problem, you can write it in the comment box. I'll try to reply it as possible, and hope this video could be beneficial to you. Thank you. Enjoy homeopathy. Merry Christmas to all of you, and have a very wonderful year ahead, which should bring a lot of joy, happiness, and prosperity to your life. Thank you very much.